Hey everyone, and welcome back to the channel. Today, we're diving into a super important and fascinating topic in medicine, beta blockers. You've probably heard of them before, but what exactly are they and how do they work? Stick with me because we're going to break it all down so it's as easy to understand as your favorite video game. The main idea, the body's brake pedal. Imagine your body is a car. Your nervous system is the driver, and things like stress, excitement, or even danger are like you pressing the gas pedal. This gas is powered by hormones called catecholamines, specifically epinephrine, which you probably know as adrenaline, and norepinephrine. These hormones bind to special docking stations on your cells, called beta receptors. Think of these receptors as the ignition switch for your body's fight or flight response. When adrenaline and noradrenaline latch onto them, they tell your heart to beat faster, your blood vessels to constrict, and your blood pressure to go up. So, what do beta blockers do? They're like a competitive parking attendant. They slide right into those beta receptor docking stations, but they don't turn on the ignition. They just sit there, blocking the real cars, epinephrine and norepinephrine, from parking and doing their job. By blocking these receptors, beta blockers essentially act as a brake pedal for your body. They weaken the effects of adrenaline, helping to slow things down. The three types of receptors. Now, not all beta receptors are the same. We have three main types. Beta 1 receptors. These are the most important ones for our discussion. They're found mainly in your heart and kidneys. Blocking these slows down your heart rate and reduces the force of each heartbeat. Beta 2 receptors. Beta 2 receptors are located in your lungs, GI tract, liver, and blood vessels. When adrenaline hits these, it can cause things like a slight relaxation of the airways. Beta 3 receptors. These are found in your fat cells and are involved in metabolism. We're still learning a lot more about these, but for now, we'll focus on the first two. The different classes of beta blockers. Not all beta blockers are created equal. Some are like a broad-spectrum bodyguard, while others are more selective. Non-selective beta blockers. They block beta 1 and beta 2. Think of these as the general-purpose bodyguards. They block both types of receptors. A great example is propranolol. This makes them very effective, but because they also block the lung receptors, they can sometimes cause issues for people with asthma. Cardioselective beta blockers. These are the specialists. They're cardioselective because they primarily target the heart. Drugs like Atenolol and Metoprolol fall into this category. They're often preferred for heart conditions because they have less effect on the lungs. Mixed beta blockers. They block both alpha and beta. These are the powerhouses. They block not only the beta receptors, but also another type of receptor called an alpha receptor. Blocking alpha receptors helps dilate blood vessels, which can be great for lowering blood pressure. Labetalol and carvedilol are classic examples. The how-to, mechanism of action. So how do they do their magic? It's a simple chain reaction. Beta blockers latch on to the beta receptors in your heart and blood vessels. This inhibits epinephrine and norepinephrine from binding those sites. The activity of the receptors weakens, and boom, you get a decrease in your blood pressure, heart rate, and the amount of work your heart has to do. This also means your heart needs less oxygen, which is super important in conditions like angina, chest pain. When do doctors prescribe them? The indications. Because of their calming effect on the heart and blood vessels, beta blockers are used to treat a wide range of conditions. High blood pressure, hypertension. This is one of their biggest uses. Heart rhythm problems, arrhythmias, they help regulate an erratic heartbeat. Angina pectoris, they reduce the heart's oxygen demand, which helps with chest pain. Migraines, Propranolol is often used to prevent migraine headaches. Anxiety, they can help with the physical symptoms of anxiety like a racing heart. And more, like preventing a second heart attack after an MI, myocardial infarction, and even treating glaucoma with eye drops like Timolo. Who should not take them? The contraindications. Just like with any medication, there are some people who should not take beta blockers. People with a complete heart block, a serious electrical problem with the heart, people with severe asthma or other serious lung conditions, especially with non-selective beta blockers, individuals with very low blood pressure already, and pregnant women because of the potential risks to the baby. Now for the stuff you need to watch out for. Common side effects can include fatigue, cold hands and feet because of the blood vessel changes, slow heartbeat, bradycardia, dizziness or lightheadedness from low blood pressure, and sometimes in men, sexual dysfunction. The dosage, this is super important, so let's quickly cover a few examples. Atenolol, a common starting dose is typically 25 to 50 milligrams and is usually taken once a day, OD. It comes in tablets and can also be given as an injection in a hospital setting. Propranolol. This one is a bit more flexible and might be taken multiple times a day. You might see a dose of 10 to 40 milligrams taken a few times a day, TDS or QID. It comes in tablets, capsules, and even liquid solutions. Metoprolol, another common one, often prescribed as a 100 milligram tablet taken once a day, OD. Just like the others, it can also be given via injection if needed. The bottom line, beta blockers are incredibly useful medications that act as a brake pedal for your body's sympathetic nervous system. They lower blood pressure, slow the heart rate, and reduce the heart's workload by blocking the effects of adrenaline. Whether it's for high blood pressure, a racing heart, or even migraines, they've helped millions of people live healthier lives. Thanks for tuning in. If you found this helpful, be sure to hit that like button, subscribe, and let me know in the comments what you want to learn about next. See you in the next video.